Question presented to us was this: I want to go to a chiropractor, but I don't want to just go in, get racked and cracked, have temporary relief. I want something more. I want lifestyle improvement. I want loosened muscles if that's what's required. I want the appropriate natural supplements. I want everything like that. Who can I go to that will do that more so than just the type of adjustment? Is that even chiropractic? Well, the short answer is me. Or any other really good chiropractor, right? It's a full circle thing, right? We affect health in as many facets as possible. That not to say that we can affect every single facet of your health. It's a full circle, kind of a pie. We are one piece of it, as other healthcare providers are other pieces, and the patient's at the center. And our job is to make sure that you are getting the proper care from all of those pieces, and we can really only do our part, but we will send you to anybody that we think could help as well if we can't. So what really is chiropractic? Well, a traditional type of definition, there are a few, is chiropractic is the science, art, and philosophy of adjusting segments of the spine by the use of the hands only for the correction of the cause of dis-ease. Now, that's a very old school definition, and in 2023, a chiropractor does much more than that. At least at my clinic, I would do a full exam on you the first day. I will do a full physical. I have to see everything that's going on. And this isn't just me. This is, a lot of chiropractors now would be doing something like this. So, when you visit your local chiropractor, make sure they're going to do all the orthopedic tests appropriate. They should be testing your range of motion. They should be checking your vitals, doing cranial nerve exam, a full physical from auscultation to abdominal palpation and all sorts of things, right? Obviously doing a full history and intake, and explaining to you exactly why you're there. If we can help you, hopefully if we can help. We may not even know that after the first day, because what I would do at least is send you for x-rays. I want to see some imaging, right? And I would almost never just slap somebody on a table the first day, right? I'm not going to throw you on the first day, give you an adjustment if I don't know what's going on inside your body yet. I need to know exactly what is going on before I know exactly what to do, right? And you could feel good from an adjustment the first day, but maybe that's not the best for you. Maybe it's not even going to help you, right? And so we see what's going on day one. We do that full exam, comprehensive, everything we can do to get a better idea of your case. We send you for x-rays. You come back the second day. I'll show you those x-rays. We'll sit down, we'll look at them. We'll see how many degrees off from normal your curve is. We'll see if we can help you, how many times a week I would need to see you. Some people it would be once, some people it's once every 2 weeks, some people it's 3 times a week or 4 times a week for just a month. They're in really rough shape. And we need to work consistently, right? And that could be the second day, and then maybe we'll get on the table and do some basic palliative stuff if someone's very acute, or maybe we'll go right into full spine adjustments. I'm not sure, but regardless, it's our job as chiropractors to make sure that we not only do an adjustment, but we affect as many facets of your health again as we can. We examine nutrition, we give workout routines, we give you exercises specific to improving posture and alignment of the spine. We work on affecting the curvature of the spine through things like cervical extension traction, for example, as we talked about the other day, right? And nutrition and lifestyle, all these things, they can go so far. The adjustment is just a small piece of our pie, and we are just a piece of the entire pie with you at the center. And so that is really what should happen when you go in to see a chiropractor. Now, what's a typical day like when you go in and say you've been coming for some time now, we've done the exams and we know what's going on, and we follow up every 4 weeks to make sure that you're on track. We test your range of motion again, go through everything, see the doctors you've been following up with. And so a typical day at, say, that point would be you probably come in, get your adjustment, we do some myofascial release, break up all the adhesions that we find in the body, right, from anything from your upper traps and levator scaps down to your erector spinae, down to hip rotators, down to your glute, anything really that we can find. Working on extremities as well, not just the axoskeleton, right? And corresponding structures. But something like that on the table. Then going and doing exercises, doing some stim, heat or ice, depending. Some people will do heat and ice, and some traction, hopefully, towards the end, to try to make a more permanent correction of your spinal curvature to help relieve pressure on the discs and nerves for a longer period of time, something that will have a lasting benefit for you. So that is pretty much what you can expect. We'll talk about nutrition. In my office, I will do nutrition consults one-on-one with patients, you know, and sprinkle in a bit of nutrition here and there, because I do think it is so important for just optimal living in general, but for recovery as well, you know, and reducing inflammation in the body. And your nerves are inflamed and you're in pain, and you know, inflammation is something that I really try to target. So you know, aside from just inflammation, a lot of nutritional talk as well. But first and foremost, it's your musculoskeletal complaints. It's getting down to business in terms of what's going on. We examine if you have a high shoulder or not, if your foot is pointed out, you know, if your knees knock when you walk, all sorts of things like that, and how to correct them. And that's it. So that's not it. There's you know, some more, but off the cuff here, off the top of my head and from my heart, I'll tell you that, you know, that is what I do. That's what we chiropractors do for the most part. Albeit there is a disparity between many different chiropractors, right, that have very different styles in their approach to achieving optimal health for people. But nonetheless, it is a natural, holistic way that you can at least prevent things from happening in the future, right? You can have faith that is looking out for your best interest of general health and can be your first stop. All right, don't make it your last stop. Make us your first stop. Because if we can't help you, then we're going to send you to somebody that can. Now, if you have an acute injury or you're bleeding and you got shot, go to the hospital, please. If you're having a stroke, go to the hospital. Right? If you have an infection, go to the hospital. I can't help you with those things immediately, but I can help you with a lot more than you might think. And really, it isn't me. It's your own body. I'm just putting your body in a position to heal. So that's it. Hope you guys had a great day today. Who is on here? Let's say hello to the people and we're going to go. What's up, crazy, sexy, cool? Selena, Christian Guerrera, Cesar Hopla, DJ Burst, Stefan Apple Blue, Bradley, Little Cakey, Natasha. Love you, Ma. Brandon Malone, how you doing? Ernst Abdulio, Helly Rachel, first one of the day, Bruno, Louise, NYC. Thanks for the support, my friend. Hope you have a fantastic rest of this beautiful day. And that's all we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a great one. Thanks so much. And happy wellness. Time to go treat some patients. Do what I love.